Welcome to the Buckingham Center for Facial Plastic Surgery. Tonight we're going to be talking a little bit about cheek deficiency, or rather the correction of cheek deficiency, which can be done through either a fat transfer or the use of fillers from syringes like Radius or Restylane or Juvederm, or an implant to the cheek. And we'll talk about that from the context of just augmenting the cheek and also from the context of facial rejuvenation or facial aging. So in that spirit, cheek deficiency comes in two forms. It comes from genetics, which is typically a bony deficiency, but also very thin people who have just very little fatty tissue covering to the cheek. And it also comes with age, and that's usually related to more fat loss from the cheek region and not so much bony loss. And so we're really talking about restoring volume lost to the cheek in that case. So this can be addressed through multiple modalities. The simplest and easiest of which is by just adding a filler. Typically we use the filler Radius to augment the cheek region. Very easy to perform. It's done in the office with just a little bit of local anesthesia. Typically no downtime, maybe just a little bit of swelling, maybe a little bit of bruising, but in general it's very low downtime. Downside to that procedure is that it's temporary. You're going to get maybe a year and a half result out of doing one of those procedures, and then you're going to have to repeat things again. So it's a great option for people who are looking to do something with little to no downtime, who don't mind repeating it, and are looking to stay out of the operating room in order to accomplish their goals. So the other methods to augmenting a cheek are to use the patient's own fatty tissue, or an autologous fat transfer, or an implant. The autologous fat transfer is performed by harvesting the patient's own fat, and it can be from their abdominal area, lateral thigh, wherever they have excess body fat. It's done through a little small incision, about 5 millimeters. Harvest that fat, process it so that we're just injecting the living fat cells, and then just through a little needle stick, each cheek, anterior, lateral, we're able to add volume back to the cheek. Now, in a person who has deficient cheeks, we're really compensating for bony deficiency by adding fat. However, by doing so, we really are able to end up with a very soft, very natural looking result, which sometimes implants don't do. The other thing we're dealing with facial rejuvenation for people who've lost volume in their cheek is we're correcting and adding cheek height to come up into the lower lid. So typically when you have facial aging, not only do you have just an overall volume loss from the cheek, but you also have this double contour to the lower eyelid, which we talk much more about when we talk about our aging face consult and our fat transfer tutorial, where we're talking about elevating the cheek, raising it up into the lower eyelid, so we take away the long appearance of the lower eyelid, make the lower eyelid look short, make the cheek look more prominent anteriorly, so that we don't end up with that double contour and that dark shadowing underneath the eye. That is very well achieved by using an autologous fat transfer, and by far is our choice to do that. You can do that with implants, but once again, in my opinion, implants tend to look more harsh, and especially in a facial rejuvenation standpoint, you're really not replacing what's missing. So we really want to replace the tissue that's missing with autologous fat, which is exactly what we need to be replacing. So in the more youthful person who really has a bony deficiency, in my opinion, that's where we can really look at using an implant, and that's where we would use that in our practice. Even though for people with very little soft tissue needs here, I would still prefer to do an autologous fat transfer than I would to do an implant, just because I'm more proficient at that procedure. I think the results are very soft and favorable, and they're long-lasting. They're going to last 10 years or longer. However, in the right person who really has a deficiency, and I think that they have enough soft tissue covering so that the implant will look natural, we can use a malar implant. We use a side-elastic implant when we do that, and it's performed through an incision up underneath the gum, where we get access to the bone, performing an elevation of the covering to the bone to make a pocket for the implant to go in. We then mark on the skin surface exactly where we want that implant to sit in that pocket, and then we'll pass a suture through a gauze roll on the outside of the skin, through the skin, and then into the implant, where we can use that to draw the implant into the precise location that it needs to be inside that pocket, and then bring the suture back out through the skin and tie it over that little cotton roll. We'll leave that little cotton roll on the outside of the cheek for about 3 days while the implant is held in that precise position, where we can then come and cut that suture and remove it, and the implant and everything around it has drawn in and around it to hold the implant in that precise place. Now, even with that precise technique, there's about a 10% chance that one of those implants can be a little bit asymmetric from the other side. So placing implants really requires a great degree of precision in order to make sure everything looks nice and symmetric. So sutures inside the mouth are absorbable. In either the case of an implant or a fat transfer, the patient's looking at about 10 to 14 days of enough swelling so that their social activities may be interrupted. Following that, typically they are good to go socially, with a little bit of some change in the amount of swelling and things to go down over the course of the next few weeks, but once again able to return to social activities in about 10 to 14 days. So hopefully that gives you a nice overview of the different techniques that are available to do cheek augmentation and restorative cheek procedures. And I encourage you to take some time to look at our photo gallery to get a better idea of what those results look like.